go ahead. We will go ahead and get started. I hope everybody can hear me okay. I project, so we should be all right. I was watching you exercise back there, and I was tapping my foot up here. I'm like, I should go back and exercise with him. And the younger me would have done that. The older me realizes, had I done that, I wouldn't be able to talk right now because I would be a little out of breath. And the funny thing is, I could do all of that back there and come back up here, but as soon as you start talking, that's when it hits you that you're out of breath. You don't really think about it, but anyway, that's nothing here nor there. But our discussion tonight, you've heard from, I believe, Lori Gilhausen, and you heard from Dr. Facolade, and you heard from Ben Miola. So you've had an assortment of things, both clinical and non-clinical. I am another non-clinical person, so my role for the hospital, as June said, is I am the public relations coordinator. So things you see out on video or in the newspapers or our Pulse magazine or different things like that, I probably had something to do with it, or it came through my desk and went on to somebody else's. But one of the things that, a little bit more about my background, first of all, worked for ACMC for, let's see, almost, this will be the 13th year that I've started with ACMC. And before that, I worked for Gazette newspapers, worked there 10 years, so I've been in the area for about 22, 23 years now. And other than today's weather, I love most of it. You know, it's obviously Ashtabula County, good place to live, good place to work. And ACMC is, one thing I told my boss when I first started was just the fact that it's an opportunity to remind people how important healthcare is in their lives, but also just get the facts out there. And not to criticize media too much, because that's what I came out of, but back in the day, our goal was to get the information out, truthful information out to everybody. And nowadays, it seems like it's changed a little bit. It's more, it's less information and more they're kind of yelling at you at some point. So what I wanted to talk about, from talking with our physicians, there are several things that in marketing that are, obviously they're designed to get you to buy something, to get you to follow some program, something like that. But there are some things that you can look for as you go through different marketing things, as you see things. So I wanted to hit a few topics today. And let's see. So I have a series of videos for you with, first one will be featuring Dr. Verdon. He is our Cleveland Clinic orthopedic surgeon. He's going to be talking about how to read a study, or how, if somebody comes out, because I see these all the time. They drop in my inbox. I see them on social media. It's like, you can lose 20 pounds in 3 days eating nothing but liver and pineapple. And you're like, oh, I kind of like liver. I really like pineapple. That sounds good. Let's try that. But there are things, and there's some study to back it up. There's information that's out there. And so I spent some time with him, and he explained a little bit more about how we can learn from these studies what's good and what's bad. In other words, we can take the good out of it, and maybe we just figure out we need to discard the whole study. Maybe we figure out, oh, there's some element that does apply to my life, but he gives us some points to be careful of. Also, we'll get into a little bit more about that. I have two other videos for you as well. One is from our wellness kitchen with our dietitian, Maureen Jacobson, explaining a little bit about fad diets. She talks a little bit about what she does with her program. And June, we get a plug in with June in the video, talking about our results, Premier Fitness's results weight management program. And then I have a small video from Dr. Bishop talking about how much sugar can impact our lives. It's a very, very short clip, but it's from one of our Dinner with the Doc events. And so I want to finish up kind of telling you a little bit about where you can find some accurate information. So we will move on with a couple of things. How many of you remember those late night infomercials? You know, the ShamWow and the guy in the rowboat that they had sprayed all that black stuff in, and so now he's out in the rowboat because it worked. I'm trying to think, what was the first? I don't remember early infomercials. Well, actually, I do remember one. Remember Mr. Microphone from Ronco back in the 70s? Okay, I'm showing. Yeah, kind of. Yeah. Total Gym. Yeah, that was a good one. Yeah, I remember those. Huh? Oh, Ginsu knives. I had some of those. Yeah. I don't remember where we ended up with them, but we had some of those too. But they're all designed to kind of get you excited about the product, get you interested in things. And nowadays we have the clickbait in the headlines for different things. Like I said, you can lose 20 pounds and, or so-and-so lost 20 pounds eating liver and pineapple. Great for so-and-so. Do I really need to know that? And I click some of these through also to read about them. But we're going to talk a little bit more about that. Pitfalls to avoid falling for the hype. And now the video that I have, it's about a 6-minute video on with Dr. Verdon explaining the studies that come out, because they all look really good. It's like, I was trying to think of one that came through my desk the other day. It was a study. Actually, I don't remember what it was, but there was a study that came through, information about it, and everybody was, starting to, in my circles, was kind of talking about, is that important? Do we need to worry about it? Do we need to follow it? And while that was going on, I read about another study that came out that said it was related to breast cancer, and in certain situations, some women may not have to have radiation in conjunction with the other immunotherapy and other treatments that they have. That's great, but what were the details in the study and who did it apply to and things like that? So just because somebody comes out with a headline, say the Cleveland Plain Dealer or MSNBC or somebody comes out with a headline, doesn't necessarily mean it's for everybody or we can trust it. And especially when it comes to healthcare. Health information is anybody with a website can tell you something, and it's whether or not you believe them or should you believe them. So I spent some time with Dr. Verdon, like I said, and he is going to explain a little bit about what to watch for in these studies.
When you have to evaluate research, especially out on the internet nowadays, there's a lot of it, and a lot of information that is some that's good, some that's excellent, and some that is downright misleading at times. However, if you're going to be bombarded with information, you have to learn how to critically evaluate it and at least look at it in a way that you can make a determination it's something you're going to use to apply to your well-being, your health, regardless of what it is. The first thing I look at is, where is it published? Is it published on something that can be edited by the general population? Is it published on for example, the New England Journal of Medicine's website? Those kinds of things I look at. What I'm looking for is a site that is reliable, respectable, that has peer review. And really, what does that mean is that the people publishing the information are being reviewed by their peers. It could be people at other journals. It could be people who are asked to read and edit the information that's being published. So that's extremely important that it's peer reviewed. The other thing you have to look at is, do you find that same information someplace else? Is that information seen and across multiple either websites or journals or articles that you're reading? Because if you see it once, it's not that it's not true, it's just something that has to be taken kind of for that it's a one-off kind of finding. The best type of research that you see is replicated, and that means that someone does a study and looks at does eating this particular food cause good health? One person says yes, and then another group does it and replicates that information so that you see that it is a experiment that not only can one lab get good results from, but can they reproduce it in another lab that's independent of the first. The other thing you might want to make sure is that nowadays, when the data is controlled by a third party, what does that mean? That means I'm funded by someone to do research who really gets to determine which part of that data is actually published, because it's not always left up to the physician or scientist to make those determinations. The other thing I like to do when I go look at research is there's a lot of information that can be gained from old research. That doesn't mean that new research isn't good, because there are great advances that are made, every day in medicine, but there's a lot of information that can be gleaned from old studies which were essentially thought of as not very important at the time they were published, but now are coming back, and modern scientists are making sure that data was correct. And I think one of the other things that's very important with regards to looking at is, did they use one subject? Is this 5 people that they looked at this information, 100? The larger we call that the N, the larger the N, the better, more likelihood the findings are real and not just something that's a one-off. So those are the kinds of things that I look at when I'm trying to evaluate research. When I'm doing it very critically for research purposes, I may look at statistical modeling as were assumptions violated, things like that. But I don't know that that's something that, if you're going as a lay person and looking for, is something you really need to do. That's something you bring to your doctor and say, hey, look, I saw this on the internet. What do you think about this? And they might tell you, I haven't seen this. But next time you come, I may be able to answer that question for you. And that's perfectly appropriate. There are times where you have to be very critical, I guess, of the population at which the research was done on. For example, if I'm a diabetic and they're testing out a new diet and it is done on people who are non-diabetic, then that may not necessarily apply to me as a diabetic. I'm not excluding that it doesn't, but that's something you need to, I think this really needs to be evaluated, is the population at which the study was performed on and the information, so that you're making sure you're comparing apples to apples and not apples to oranges.
Okay, so he covered several points in there, so I'll just get those up here. Where is it published? Like I said, anybody can put up a website these days, and I'm always when I'm reading stuff, looking for information, personally and professionally. I will see stuff on Facebook, I'll see stuff on other social media, and a headline will catch my eye, and I'll start to click on it to go look at it. I'm like, wait a minute, I don't remember, I don't know who that is. It's not one of the main news websites. It's not one of the, or even one of the political sites or religious sites or something like that. It's like you see this headline, you're like, oh, I want to know more about that. Well, you look at the bottom and it tells you where, before you click it, what website it's on. And so I found this headline and it said, 2 big buddies. And I'm like, I don't know who 2 big buddies are. That's great. They have that friendship, but I don't know that they're health experts. If it had said 2 doctors or something like that, I might have trusted it a little bit more. So we have to be careful with some of that stuff. Is it peer reviewed? In other words, are other physicians evaluating it? Same thing with, can you find it elsewhere? If it's just one location, and this is where I think that a lot of people get in trouble on social media, is we see something, and nowadays everybody wants to be first. Everybody wants to be the first one to put it out on social media and talk about it. So they run out and they put it out on social media, and maybe they just have one source of information. As a journalist, I was always taught, don't go with one source of information, because I could be talking to June about something, and June has a lot of great ideas, but those are just June's ideas. And maybe I go talk to Hannah, and Hannah's like, well, that sounds good, but I would do it differently this way. Or maybe she had read some different information, and so we have a different set of facts that we're dealing with. So we have to be careful with things like that. Obviously, is the research replicated? In other words, if one group comes in and does a study and shows something, can somebody else duplicate that same information? That becomes important when you're talking about treatments and medication and things like that. And then who controls the data? It's like if I read a story about how it is super helpful to you for your health to eat to drink a gallon of milk every day, and it's put out by the Dairy Producers of America, that may be a little biased. Or maybe they control the data and they don't want anybody else to have their data. That's the other side of it. And I'm nothing against the Dairy Producers of America. That's a good source for milk-related things, but you have to take that with a grain of salt as well. Who controls the data? And this is the one that I always tend to look at, probably more than anything, because a study comes out and, say, MSNBC reports this new fascinating thing about medicine. Well, you look at it, or politics or religion or whatever it is, you look at it and they're like, we surveyed 50 people, and this is what America says. Well, that 50 people may not represent America. Where are they from? Are they from one person from each state, or are they all in Ohio, or right on the state line with PA or something? But if they surveyed 10,000 people, then maybe you're a little more likely to get good information from that. I was reading a study yesterday, and they said that they started with 3,000 people, but by the time they were done with it, they had less than 1,000 respondents because people kept dropping out. It was voluntary. You could answer so many questions and then go the next set and go the next set. So, but they still had 1,000 people, which I thought was interesting because that still made the study fairly valid. And then does the study apply to a select group? Like Dr. Verdon said, say you're reading a study about diabetes and it's all about type 1 diabetes and you're trying to learn about type 2 and they have medication that works for type 1, type 2 diabetes, people with type 2 diabetes may need to be a little cautious with that. So again, talk with your provider. That's the bottom line for anything with a study. And I found that most of them are willing to talk about things because it's like he said, they may not be up to date on the latest study that just came out, but they're always happy to research it and find out more or tell you if that's a legitimate site or not. Talked with one of our former cardiologists, and he loved digging into this kind of stuff to find out if it was real or if it was just hype. And so that's kind of what got me started on this, whether they really help or they're just hype, people trying to make money off of it or whatever. And I should have started the discussion asking you this question: where do you get most of your news, health news or any news from? Is it one particular source? Is it TV? Is it newspapers? Is it social media? But where do you get your news from? What do you think? Yeah.
BBC on my phone.
Okay. Yep, on your phone. So it comes right to your phone. Yep. You said BBC?
Yeah.
Okay. Who else? Anybody else? Yes, ma'am. NPR radio. Okay, on the dial, radio or on click whatever. We don't have dials that way. Push buttons, right? So at home and in cars. Satellite or just regular terrestrial radio? Okay, I love terrestrial radio. I used to do a talk show on the AM station, AM 970, and so I have a heart for terrestrial radio. It's a shame it's kind of going by the wayside. So I asked the same question of a group of teenagers, and most of them get their news from YouTube. Yeah. So nothing wrong with YouTube. We have a YouTube site, which I'll show you in a few minutes. But I asked them, what are your goals? What do you want to be when you grow up kind of question. And every one of them said, I want to be a social media influencer. And I said, why do you want to be a social media influencer? And it wasn't to influence people. It was to make money because they see that's where all the money is. And it really annoys me with this type of stuff because so many people that are out there. I clicked on a video. I was wanting to find out some specific information for a story that I was writing over at the hospital. And the person, let me get one of my notes called up here so I can get this in the right order. So the person, it's a video, and I hate watching videos to get news or information because you have to watch it at their pace. You can't just, it's like text. You can just scroll through it. And back when I was a journalist, we were always taught you write the inverted pyramid. So in other words, the most important information's here, then you go here, and then eventually it gets down toward the bottom tip of the pyramid. And that's where the editors know they can just start chopping if it's too long, and they can start cutting. But the most important information is always at the top. Because things are more narrative these days, you don't get that. You get more of a kind of meandering story discussion. So I really wanted to find out what this person was going to say about this specific news. So I tune in. It's the video. They're sitting in their car. So I knew I was I was in for something because they were sitting in their car. And so they get out of their car. They walk to the back of the car. They open the back up, and they're like, "It's a little chilly out today. I'm gonna put on my jacket." So they put on their jacket, and they make sure they fluff down right here so you can see the logo that's on there. And then they close the trunk lid or the gate lid, and so then they're standing there, and it just happens to be by the emblem on the back of the car, so you know what model of car it is. And so they go walking out through the woods. Now they're telling you news that has nothing to do with them out in the woods, but they're talking about things as they walk. And so they're kind of meandering in their conversation. They're meandering as they walk, and they stop, and they're like, "Oh, it's still now that I've got the jacket on, I'm a little warm." They wipe their brow, and amazingly enough, there's a towel that has a logo on it, different brand of something they're promoting. So they keep walking and everything. I don't know why they didn't take the jacket off at that point, but they still had to get the logo in, I guess. So they're walking, and then I start thinking, who's filming this? Is there some guy over there like me walking backwards as they're going down through here? And sure enough, you had to figure that was, because both of their hands are in this. So anyway, long story short, they stop and they take a drink out of something, and they open it up, and I'm not going to turn the label this way, but they had the label prominent so you could see what the water bottle was. They took a drink, and they're like, this is a new recipe of whatever I've got, and it's some powder that you put in, and you can get it on my website, but and so then the logo for that thing flashes up there. It took them, and I just started fast forwarding at that point, it took them 12 minutes to get to the information I wanted to know, but they had all these product placements and all this other stuff in there. So I don't know whether to trust them or not, but it was interesting information. But then I also got to see 7 or 8 different labels and logos and things like that. But the bottom, and that's what really annoys me about this. If the information was factual, obviously they're not just going to get out of their car and say, "Hey, here's what I want to talk to you about," and give you the information, because 30 seconds after you get the information, you're probably going to turn off and go watch something else. So they have to keep you engaged and keep you watching. So that to me is a little more annoying, because part of what I have to do is get you the information and get it to you quickly. But we have a lot of different vehicles for doing that with ACMC, and other hospitals do as well. For example, the one that we're going to look at now, the video with Maureen Jacobson and June. I want to make sure June gets her credit. I didn't put her name up there, but she's here, and you guys know her already. But this was a segment from our wellness kitchen. Now, if you've never seen this, we have so much fun with this. We should do a blooper reel sometime of the fun we have behind. But we have over a Premiere in the back. We have a full kitchen, not a full kitchen, but it's a kitchen set up with. I've got my cameras set up. We've got the lights. June and Allison Loudermilk, our community outreach coordinator, and some others will take part in this. And we invite our physicians or our non-clinical folks, and we have invited some people from the community to come in, and they cook a meal right there, different recipes. And of course, I video all of this, so I'm behind the camera. Now, Friday, I'm actually going to be in front of the camera as we record something that will be broadcast next week or the week after. But it's an opportunity for people to come in and talk about what they do. So we had 2 of our pediatricians come in, and they talked about common childhood illnesses. They talked about kids staying safe in school. They talked about nutrition and health and things like that, all while they're putting this stuff together. So it's a fun way to keep, again, this is kind of that influencer mentality of narrative, telling you a story. The story is you're learning how to cook healthier, but you're getting additional information thrown in. And I feel, obviously I'm biased because I work for the hospital, but I believe that the information we put out is factual, obviously, and it's to be trusted because we do our research and find out either the nutritional side of it, but there's an entertainment element as well because that's what people are looking for these days. I thought this was interesting from Maureen's appearance where she started talking about some of the fad diets that are out there because I had just emailed all of our family medicine and internal medicine specialists, and I said, a friend of mine on Facebook said that he's doing the carnivore diet. And that sounded really good to me. I'm like, carnivore diet? What is that about? And he's like, I eat nothing but meat. And I said, nothing but meat? What about the vegetables? Where are you getting your carbs and all that? He goes, well, we have to take supplements. We just eat meat. We're like cavemen. And I said, I don't think that's good. And he's like, I lost 40 pounds doing this. And so I emailed all of our doctors, and one of the doctors wrote me back right away, and he said, I do not comment on fad diets. So, and another one actually sent me some factual information and said, here's why this is bad, why it sometimes works, why it doesn't. Tell people don't just do the carnivore diet. So when Maureen brought this up, I thought it would be good to share a little bit.
We've talked a lot, in diet education with patients at the hospital about the Mediterranean diet, and this will fit in lots of different vegetables and legumes and all of that good stuff. Olive oil.
So speaking of diets,
Yes.
you mentioned, I know there's a few, Mediterranean, low fat.
Yeah, low fat. There's low cholesterol, low fat. There's heart healthy. The heart healthy encompasses all of that plus low sodium. I'd say I also teach cardiac rehab at the hospital as well, and we talk about that heart healthy diet quite a bit, and the Mediterranean diet. Now there are a lot of fad diets out there too, so you do want to be careful because some of them really do need medical monitoring. So I wouldn't advise just looking at the internet and just picking one. Just make sure you're running everything by your doctor and dietitian too. If they'd like to include us, we can help you as well.
What we found here,
So that
we talk to people, youthful, is, and I'm sure you'll agree, just healthy eating for the rest of your life. Like you can't, if you go on a diet, you could lose the weight, but then you're depriving yourself, and then you're going to end up gaining more weight, and it's like a vicious cycle that you get into. So if you just learn how to change your lifestyle, eating right, exercising,
coming to the gym,
and then
or doing it at
home,
it's
much easier to maintain.
I agree 100%, and we've seen that over and over again. And I have found in my career that the best success comes from patients or clients in general who will do healthy eating plus exercise. So we find that if you combine both of them, you stand a much better chance of keeping all that weight off.
We have a program here called the Results Weight Management Program. So we still do that. It's a 12-week program. And we have not dietitians really, but we have, certified health coaches, and they'll talk about healthy eating. So when you do that program, it's 12 weeks. You get to meet with one of the health coaches once a week, and then you have personal training twice a week. So that is great because like I said, we don't advocate fad diets or pills or anything like that. They work with you for the 12 weeks. You get the exercise and you get to eat healthy. And then hopefully by that 12 weeks, then you've maintained it. It's become a habit.
Yes.
Because it takes, how many weeks do you think to change a habit?
12.
Okay, they're perfect. So we get the right amount of weeks for the program. But yeah, so if anyone's interested in that program, please give us a call at Premier. We can get you hooked up with that. Okay, so the salad is done. Beautiful.
So the recipes that we go through on those are all online. They're on our YouTube page, and a lot of good information scattered in between the making of the food and everything, which we've done some tremendous, some very well made and healthy and great tasting recipes on there. So really quickly, I know we got to wrap up here in just a couple of minutes, but wanted to put in a couple of plugs for our information where you can find it, because we put out a lot of information not just to the local papers. I don't know if you get the Star Beacon or the Gazette, but Star Beacon today had their health and fitness section in. We had a couple of articles in that. We have our Pulse magazine, which goes out to to a lot of the households here in Ashtabula County, especially the northern part of the county. And we put a whole bunch of stuff out on social media, YouTube, Facebook, Twitter, LinkedIn, Instagram, Pinterest. Of course, we have our website, acmchealth.org. This happens to be our YouTube site. You can see Ben Miola there. We have Caroline doing some exercises. Over here on this side, we had our heart luncheon that we just did with Dr. Al-Assad he's one of the Cleveland Clinic cardiologists. And he had people laughing at that event, and it was a good time. But we try to get our primary or all of our providers involved so that we get as much information out as we can. Some of the events that we're doing right now, like I said, to get these out, the Wellness Kitchen Premier Fitness does lunch and learns once a month. We just started this back again a few months ago. We used to do dinner with a doc, and we would invite people to come in, and you could sit around a table and eat, and it was, I don't remember how much we charged, but that was to cover the cost of the food. We would have it catered. People could come in, a doctor would come in to speak for 15 or 20 minutes, and then people sitting around the table could ask their questions. We kept it intentionally small because we wanted people to feel comfortable, because if you've got 5 or 10 people there, you're more comfortable than if you've got 55 people there. Well, what we found out was that was great a certain time of the year, but in the wintertime, nobody wanted to come out to those. So and then things changed, so we kind of put that idea on the shelf. Now we've brought it back, and we're doing it out at various locations around the community. And I don't know if any of you have attended those or not, but we've had 3 of those so far. The smallest one, I think, had 40 people at it. But it was, again, dinner, sitting around tables, and people are much more comfortable now than they were 15 years ago or 10 years ago, talking about health things in public. It's an interesting transition. And so people come out, and some people get very personal with their questions. Other people keep them generic. But it's an opportunity for people to come out for free at this event now and be able to ask a question. And so what I want to finish with is showing you, well, I've got one more thing after this, but show you one of the clips that Dr. Bishop, she is one of our gerontologists, talking about the effects of sugar. It's a very, very short clip because of the background noise. I didn't want to keep it too long. But it just gives you an idea of the things that she ended up talking for, I think, an hour and a quarter about things as people just kept asking more questions. And it went by like that. It's kind of like Ben's discussion last week. Certain people, you get that information, you don't mind sitting there listening to them. But here is Dr. Bishop.
So one of the things that they have found in Alzheimer's is that there's something called amyloid plaques that fill up that occur in the brain. So they're showing sugars as you eat that cookie next year. So they're showing less sugars, less alcohol, unless you drink red wine. Staying healthy with fruits and vegetables, less fried foods, fatty foods. So they're showing that diet makes a big difference in that. The other thing that makes a big difference is brain activity. So you do things that keep your brain active. If you have high cholesterol, you get cholesterol treated. You have high blood pressure, get that blood pressure down. You're diabetic, make sure that A1C is less than 5. So those are the things that they look at. But yeah, that's what you can do now. And they're doing so much studies on sugar.
So she started off that there was a question about dementia, and that was the whole point of her discussion was dementia. And she was talking about the plaque that builds up in the vessels in the brain and other places. And to me, it's all fascinating because I've had 3 family members that have had Parkinson's. I've had a couple of others that have had dementia, and my dad has had 3 strokes that we know of, at least 3 strokes. So for me, I'm researching some of this stuff for personal reasons as well. And I always enjoy sharing the information